Welcome to the Transforming Assessment webinar series. Today's session is Risk-Aware, Enhancing Students' Clinical Competence in Risky Environments through Blended Simulation Learning. And our speaker today is Jade Sheen from Deakin University in the same city as we are here. So welcome, Jade. Would you like to begin, please?
Fantastic. Thank you very much, Matthew, and thank you to the audience for your time. It's a pleasure to be here. Today, I thought I might just introduce myself. So my name's Dr. Jade Sheen, as Matthew indicated, and I am a staff member through the School of Psychology at Deakin University. I hold the role of Director of Simulation-Based Education and also lead our digital advancement portfolio. I particularly teach into postgraduate clinical psychology. And I thought that I would start today's presentation with a story. About 5 years ago, I was providing top-up supervision to a student that was undertaking workplace learning. So within psychology, top-up supervision is sometimes provided when a workplace supervisor is unavailable or is on leave, and so an academic might fulfill that role. And during this supervision session, the student described, almost in an offhand manner, an incident that had occurred while in the mental health inpatient unit that she was placed at. So the student talked about walking past a number of staff into the unit to see her patient. She was dressed in her usual work attire, a shirt, slacks, had her long hair left down, and went and approached her client. About 10 minutes into her session, another patient approached her, and that patient was acutely unwell at the time, and unfortunately has grabbed her hair, pulled and removed a number of clumps of hair in the process. Now, thankfully, staff were right onto it. They responded really quickly, and she said that she was reported left without any sort of further physical injury. When she was talking to me about it, she was almost providing this impression that this was a normal work-integrated learning experience, that that's what one might expect whilst working on an inpatient unit. And it left me as an educator concerned, I guess, across a number of areas. The first is that there was this high degree of assumed knowledge. It highlights the gap between the assumed knowledge that staff thought that she had versus the actual knowledge. They assumed that she would know to check in about other patients on the unit, and this patient in particular had already been flagged as a risk. But because that risk had been flagged at a staff meeting, she actually hadn't been aware of it. So there's this high degree of assumed knowledge, but in addition to that, there was a high degree of uncertainty with regards to this student in terms of identifying what actually constitutes risk. Is this normal, or is this actually a concern? And it was this experience, along with a number of other supervision experiences with students, that really prompted my interest in the area of student risk, and specifically led to the program Risk-Aware, which we'll be talking about today. Now, with regards to some housekeeping, I will have someone that's going to moderate our chat function, and we will pause for some specific chat moments. But I'm just waiting for her to come into the room. So unless there's anything urgent, I'm going to try not to pay too much attention to that bottom corner for the moment. So today we're here to talk about Risk-Aware, which is a program that's designed to enhance students' clinical competence in risky environments. And this is primarily through an online e-learning experience that includes aspects of simulation-based education. Risk-Aware was developed through an Office of Learning and Teaching Innovation Development grant, in fact, the last round of those grants, and in collaboration with a number of other universities. So University of New England, University of Southern Queensland, the University of Adelaide, Flinders University, the University of Western Australia, and Australian Catholic University, as well as Cabrini Healthcare. So I just want to take a moment to thank our partners and just to give a nod to them as we move forward. Alrighty, so to provide some context for the presentation and just more broadly, so far in this presentation I've already referred to the idea of work-integrated learning or workplace learning. In psychology and indeed across healthcare, we refer often to these learning experiences as clinical placement. Clinical placement enables consolidation and extension of emerging skills in a workplace context. it's also thought that clinical placement offers an opportunity to be socialised to the workplace context. And whilst I am a director of simulation-based education, I'll certainly concede that there are elements of this experience that at the moment we just can't replicate. And it's important to view that moving forward, because I will talk about some of the challenges associated with clinical placement, and I'll certainly be the last person to suggest that it does not have a very important place in student education, because it does. So in psychology particularly, trainees are expected to complete a minimum of 1,000 hours of supervised clinical practice as a part of their postgraduate education. So Matthew's outlined the role of the poll, so I thought we might go to one of those early. If you have a look at the poll near your name, what I'd like you to do is to click yes if you currently have students engaged in clinical placement or some other form of work integrated learning.
Just for the benefit of the audience, I'm going to say there's 9 people ticking yes so far. So Jade, I forgot to tell you that the audience may not see the ticks. 10 now, okay. There's a couple of people.
Okay, thank you, Matthew.
That's good.
And more importantly, we don't actually have any no's.
Okay, they can see them. Okay, cool. Yay. Thank you, Esther.
Excellent. So what I'm going to assume is that there is a high degree of work integrated learning and experience amongst the educators and other people in this forum. And so I'm hoping that even if aspects of the program that we're going to talk about don't apply directly to your own cohort, that these issues of risk whilst undertaking work integrated learning or clinical placement are hopefully going to be relevant to the majority of you. Okay, so just moving forward, as I said, clinical placement certainly has a role. However, there are a number of concerns in relation to clinical placement, and so we're just going to take a moment to highlight some of those. The first is declining access to placements due to increasing student numbers. Anyone that's working currently in the Australian context will be aware that when we took the caps off student numbers, there's been a significant increase in student load as a result. There's also, particularly in psychology, a limited availability of appropriately qualified placement supervisors. In our specific discipline, when there was a movement towards Medicare rebates and therefore greater numbers of private practice, there was a drain in terms of placed experienced supervisors from those community settings and those public settings where students generally undertake placement into the private sector. And so there's significant concerns about just trying to find the appropriately qualified supervisors. In addition to this, there are risks associated with student exposure to unpredictable placement environments, and it is the latter that we're going to focus on today. So in 1999, Perrone identified healthcare as the single most dangerous workplace in Australia. Whilst it's obviously an outdated reference, when you have a look and take a moment to read the newspaper headlines on this screen, and these have just occurred in the last 12 months, you could safely assume that little has changed. When we consider the first, staff in shock after a series of violent assaults by patients on secure unit nurses. Health staff call on government to protect them from violence and aggression at work. We can see that the healthcare system is associated with a number of risks, and students in healthcare undertake placement within these contexts. Now it's interesting, when I have a look at the chat function, I'm certainly seeing that there are challenges and risks associated with a number of other disciplines. So Matthew's indicating that engineering, mining, hospitality and so on face a number of risks associated with work integrated learning, and Jane is indicating that there's obviously a large placement shortfall for nursing as well. So some of these risks, while I'm talking about psychology particularly, occur across a number of different disciplines. Moving back to our polls, I'm hoping that you might be able to tick yes if your institution currently offers students or trainees formal risk management training prior to undertaking their clinical placement or their work integrated learning? And so what I'm seeing is large trends in the opposite direction. There's one shining light, thank you, Helen, and she's certainly indicating that there is some form of formal training, but for the majority of us, and this was certainly the case at the university that I work at, there is no formal training, it was no formal training to help students to identify and manage risk prior to undertaking work practice. And there's a few people saying that they're not quite sure for their context. So there raises a question, why is that? And in my discussion with key stakeholders, I could identify a couple of issues, but one that's particularly relevant to higher education providers, and that's this idea about where the risk essentially sits. So education providers often identify that the workplace training and the risk management training that should occur really rests with the placement provider. Whereas placement providers will say, look, students are more than welcome to undertake whatever induction or whatever things we do provide, but that often they don't have a formal process for actually orienting students and inducting them and helping them to manage risk. And so essentially students are falling through the gaps. So I would like to argue, perhaps somewhat controversially, that it's the role of education providers to ensure that this gap is addressed, to ensure that our students are safe whilst they're undertaking university-required work. So it's with this understanding that I'd like to take a moment to think about what current programs exist to address this idea of workplace risk. Now, I've put this particular ad on the screen because this is a recent initiative in Victoria, Australia, that was taken up by WorkSafe, and it's an ad campaign and a number of associated videos and a website that is trying to communicate to the community that aggression and violence against healthcare workers is never okay. In fact, a number of years ago, there was actually specific legislation that was brought about to increase penalties for anyone that was aggressive towards healthcare staff because it was recognised as being such a concern. So while there are some formal programs, and when we talk to healthcare services, they indicate that their staff are trained, whether it be through professional development portfolios or avenues, through induction and through other means, students often fall through this gap. So Helen is indicating that student nurses in her program are given management of violence and aggression in first year and in third year, so before starting placement and before qualifying, which I think is fantastic and a really good start. It might be, Helen, that we might be able to add a couple of extra ideas to your suite of orientations for your students. So just to summarise, what I've highlighted thus far is that there are risks associated with the workplace context, that our students undertake work integrated learning within these contexts, and that students need to be trained to identify and to manage these risks. That previously there has been a dispute between workplace contexts and university or education providers about who should take up that role. But my argument is that it should be the education providers, first and foremost, that ensure that there is a generic education that's provided to students. It doesn't mean that we can orient them to each workplace, and certainly that is the role of the workplace itself. But I do believe that we have a role in preparing students for these risks. So moving on to Risk Aware, which is designed to address this gap and to help students to identify and manage risk. Risk Aware was developed through a two-step process. So the first process, or phase one, explored direct risks to students that were associated with clinical placement. So whilst we had a sense of the types of risks that they're exposed to, we needed to actually ascertain the, a clear understanding of those risks in order to develop our program. So we undertook a literature review. We surveyed postgraduate psychology students that had undertaken clinical placement across 4 states across Victoria. And we also engaged key stakeholders such as university and placement supervisors and workplace managers in semi-structured interviews to ascertain their understanding of risk and students. Phase 1 resulted in the following findings. The literature review indicated that healthcare students are indeed exposed to a number of risks, as we've indicated. These include psychological and emotional risk, verbal and physical abuse, and so programs like the one that Helen has indicated would certainly be helpful in that regard. Work-related injury, horizontal violence, so violence between peers, and also violence and bullying in some instances from staff towards students, and concerns regarding the impact of supervision and barriers to attaining educational needs and educational experiences. Now, our survey of psychology students echoed these concerns largely. The survey also indicated that despite students reporting a number of circumstances in which they were exposed to risk, no formal incident reports were filed. In one physical incident, an incident report was filed with the healthcare organisation, but across the surveys, no one else reported filing an incident report, and certainly at a university level, there were no incident reports filed. And so what this highlights is firstly, either a reluctance to formally report or a concern regarding the ability to identify something as a risk, or like the student in the story that I opened with, perhaps normalising experiences that are risks and expecting that this is a normal thing for the workplace context. So there were concerns around incident reporting, and the other concern is that they weren't always sure about where to file incident reports. Do I file it with the workplace or do I file it with my university? The concern as a university education provider is that if we're not aware of the circumstances and the risky situations that our students are experiencing, then we actually can't do much about it. Now, when we look at the semi-structured interviews with key stakeholders, including supervisors, these stakeholders reported knowledge of a number of near misses for students, but few adverse events, which means that students have been exposed to potentially risky situations, but to date, there have been no significant injury. There are also concerns that students were not appropriately identifying risks. So similarly to the situation I described earlier, staff will talk about situations with students and say things like, are you aware that having your hair out like that actually poses a risk? That if you have it out and you come across a patient that does want to behave in an aggressive manner towards you, it becomes something that can be used against you. But students weren't even able to identify that as a potential near miss. There was also concern regarding a lack of clarity within reporting procedures between partners. So staff were very clear on the reporting procedures that were required within their own institution. However, when asked about the reporting procedures for university staff at placement locations or for placement staff within the university, they were unsure. So it seems that there was a lack of communication between those contexts that again could potentially pose a problem to students. So in phase 2, where we developed and then implemented and tested Risk Aware, we took these findings and we used them to develop a program that would enhance students' clinical competence in these risky environments. So Risk Aware has 3 primary objectives. The first is to help students to identify the risks that they might encounter in a placement context. The second is to help students to manage or to mitigate those risks. And the final one is to help students to more effectively communicate those risks, both to their education providers and to their placement providers. What you see on this slide is a screenshot of the landing page for Risk Aware. Now, unfortunately, as risk would have it, our server, who is not connected with the development of the program, has decided to undertake updates on the server. And so I currently cannot access my program to show you, but I figure that that's probably just mitigating a possible digital issue anyway. So I've taken a number of still shots and we'll talk through those. I've also provided the link to the demo site, which you can explore after 12 o'clock tomorrow when the website becomes available again. So looking at this landing page, what you'll see is firstly a welcome video to Risk Aware. So that welcome orients students to the e-learning package. It helps them to understand how to use the platform, what they might expect within the platform, and what sorts of things they can access on this site. You'll also see 7 learning modules, and these learning modules were developed based, as I said, on the findings of phase 1. So the first module, self-management, looks at students' ability to manage or to mitigate risk to themselves, and looks at things like how they dress themselves to prepare for clinical placement, how they manage their social media presence to mitigate risk. So in a lot of disciplines, including psychology, the use of social media is highlighted quite a lot. For example, we talk about, don't talk about patients, don't talk about confidential things on social media platforms, do not share patient details, even if you think you're being smart and sneaky about it. But we don't often talk about things like don't tag yourself in your geolocation. If there's a possibility that patients might be able to find you. Or don't use the same name for your workplace context as you do on your social media platforms. So this particular module addresses those types of concerns. The interpersonal module is one that a lot of workplaces will actually have as a compulsory induction. I know that I just completed it at Deakin and we complete it every year. But it's included just, again, to make sure that that assumed knowledge versus actual knowledge gap doesn't occur. So the interpersonal module looks at things like bullying, sexual harassment, other forms of harassment, and stalking. And stalking is an issue in the mental health sector that is raised but is very rarely addressed in induction to placements. So that one was of particular concern to include, particularly as a number of our students engage with patients in a forensic setting. The next module was an infection control one, and I'm just seeing that Matthew's making a comment about using fake names as being a good thing on social media anyway. Which is a very good point. But as he's also pointing out, social media platforms are used to verify our details across a number of different online sites. I know that I was logging into a site recently and it had the option to log in via Facebook. And, so I did that and it just highlighted to me how easy it is to to run into issues of risk around that. Sorry, I'm just having a look at Tim Hunt's comment here and saying that he's sitting here thinking that he's really glad he doesn't work in the healthcare sector. And I think that we should highlight that, today's presentation we are focusing on the difficult situations and some of the worst situations, and it's not all day, every day. But it's common enough for it to be an issue that needs to be addressed. And I should also say that after presenting this material across the world now, I've had people from IT, from education, from law approaching me saying we need programs like this because our students are exposed to similar risk. So I'm just going to move back to the content of the modules. We've included infection control, which didn't come up within a literature review as an issue for psychologists particularly, but does come up within other disciplines. And importantly, that students in psychology, particularly if they work in hospitals and healthcare services, should be aware of infection control protocols. We just don't have much awareness of them. The environmental module helps students to prepare for working in different environments. So doing things like home visits to inpatient units to community units and the different levels of care and awareness that we need to have when we're working across those different environments. The aggression and physical violence module focuses particularly on, in terms of management of aggression, identifying whether or not a patient or a family member is becoming aggressive, but then also de-escalation. And my knowledge and understanding of the literature is that most other healthcare disciplines will rely on interventions like seclusion, sedation and restraint when a patient becomes aggressive. But in psychology particularly, we have a lack of access to those interventions most of the time. And as I tell my students, you know, when I started training in the CAT team, which is a crisis assessment team, we were working in people's home, and if someone became aggressive, we had our running feet and our mouth to talk with, and so we have to use those things effectively. And so we train students to identify this risk early and to know what to do should they be exposed to it. The psychological and emotional risk unit helps students to identify the emotional and psychological impact of the work on themselves and how to manage that. And the education unit is something that came up through our literature review, and interestingly was not one that we necessarily would have predicted going into this project. So this module addresses things like communicating with your supervisor, how to get your education needs met in a workplace context, and how we actually address learning needs and overt those learning needs to staff and other peers. Just a couple of other things about the site before we move into the actual content of the modules. You'll see on the right-hand side that there's a line for certificates. Certificates are downloaded at the conclusion of each module, so these are digital certificates, so they can't be faked, and students undertaking risk aware have to give each of those certificates to a placement coordinator before they're allowed to undertake clinical placement, both within our School of Psychology and within every partner institution that we have. It's compulsory. You'll see the next tab down talks about the Safe Placement Guide. And I just wanted to take a moment to highlight the Safe Placement Guide because it's something that is freely accessible to anyone that's wanting to access it and goes currently beyond psychology. So it's essentially a checklist that helps to guide placement conversations so that when a university placement coordinator and a supervisor at the workplace site are meeting, that they can guide the conversation and make sure that the student is aware of things like the fire exits and policies and procedures around home visits and those sorts of things. So it's a PDF form, and you can download it and use it in any of those conversations with your students. Alrighty, so in terms of the educational design, RiskAware, as I said, is an e-learning platform and it's simulation-based. So we utilise simulation throughout each of the modules, and it was designed to align with Kolb's model of experiential learning. So just to kind of remind people and to reiterate what Kolb's model of experiential learning is, what we're hoping to do is to provide students with a concrete experience. So by doing the modules, by also engaging in their placements, they have a concrete experience. They then have some reflective observations. So we ask them to reflect on some of the case studies and on some of the video simulations that they watch. We also ask them throughout the modules to reflect on the learning that's presented. And then we move toward abstract conceptualization by asking them to apply that learning within their own workplace context or within sort of experiences that they have come across before they have an opportunity to do active experimentation. So this would be through live workshops and live simulations at their individual university or higher education provider. The last active experimentation option is not a core part of RiskAware, but is an optional extra that most of us have been engaging in. So looking at how each of these modules are constructed, they sit within a storyline file, and storyline is narrated and allows students to firstly complete a pre-quiz, then complete the module and a post-quiz, and so that helps us to ascertain some of the evaluation data that I'll talk about in a moment. Each module will contain, within this storyline file, theoretical content, clinical dilemmas, quizzes, and embedded virtual and video-based simulation. Alrighty, so when we have a look at this screen, this is an example of some of the video-based simulations that students were presented with, where they, so for example, this one is one where they watch a scenario with a patient and have to highlight at the conclusion of it what they thought the factors were that might contribute to that patient's escalation. So based on the learning that they had, where they were helped to identify internal and external factors that contribute to aggression, they then apply it in this way and reflect on it. I should note from a learning perspective that the simulations were very highly ranked. So these were the learning experiences that students found the most favourable. What we also did was, instead of doing written case studies or clinical dilemmas, we presented them through videos with two simulated students, Cynthia and Matt. And so we have these direct to cameras where in this one, Cynthia is talking to the camera about a clinical dilemma that she faced in a workplace context. So the educational idea behind this was that students would be able to engage and immerse in this content more readily when they could see another student and can sort of contextualize that experience and that learning. So by aligning with Cynthia and with Matt, that they would be able to see themselves potentially within that role. Interestingly, the feedback from the modules didn't necessarily indicate that. So unlike the video simulations, where there was essentially a 99% agreement that they were very, very well placed, the clinical dilemmas were about 60-40. So 60% loved them and 40% didn't. And the 40% that didn't indicated that it is much quicker to read a clinical dilemma than it is to watch the videos. And so it became an issue about time. And I felt that it wasn't appropriate use of time management because it didn't necessarily add, from the perspective of the 40%, to the learning experience. And so it's just worthwhile for anyone that is developing these types of simulations or scenarios to kind of take that learning into account. We certainly will. So looking at our evaluation, so students completed Risk Aware across our partner universities and within Deakin University last year. So this was the beta version of Risk Aware. We're now up to version 2.0. Within this beta version, students in first year psychology were included within our evaluation. So even though we've had some 580 students across Australia complete the program, we only included first year students that engaged with the program with a set kind of methodology in the evaluation, and so there were 149 participant results that we included in the evaluation that I'll talk about. It's worth bearing in mind that 570 doesn't sound like a large amount of students to someone in a nursing context where perhaps they can have 2,500 in an undergraduate nursing unit. However, that represents nearly 30% of postgraduate psychology students across Australia. So percentage-wise, for the beta version, for our initial rollout, these were very good numbers. When we have a look at the method, at the commencement of each Risk Aware module, and then following the completion of each Risk Aware module, students were asked to provide confidence ratings in their ability to identify and manage specific risk. They were asked to complete a knowledge-based quiz around risk and around sort of theoretical content, and to complete a competency-based assessment where we gave them a number of clinical scenarios and asked them to provide responses. We also did a subsample of participants that completed semi-structured interviews once they'd actually undertaken placement. So they did risk-aware pre-placement. We then let them go out on placement for 3 months and got them to come back and reflect on the learning in the context of their most recent workplace learning experience. So what did the results indicate? Based on this evaluation data, we found a significant increase in confidence and in student knowledge. We found that there was an excellent achievement of competency-based items following the modules. However, there was one exception to that, and that was the Module 6, Psychological and Emotional Health. We found that there was a ceiling effect there, where students were already rating highly at the point of pre-module, so the pre-module quiz. And our theory on that is that these are postgraduate psychology students, and that in some way we would hope that they actually do pretty well with psychological and emotional risk. So it's going to be interesting when we look at an interdisciplinary version of this program to see if that effect changes across other disciplines. There also needs to be further work to understand the relationship between students' previous experience, their confidence undertaking placement and managing risk, and the timing of placement. We were surprised actually at the amount of placement and workplace experience that our postgraduate students had, even just entering the program, and this wasn't actually predicted. So we need to do further research to actually have a look at whether or not that previous workplace experience impacts their actual ability to manage risk. Preliminary results indicate that, if anything, people that have had more workplace experience prior to undertaking psychology-specific workplace experience tend to be a lot more blasé about managing risk. And I see actually that Tim has highlighted that they could very well be overconfident, and that certainly seems to be the case, Tim. Also, Matthew's indicating that if the students were undergraduate, then the degree of change may be greater. So even though the change that we found was significant, certainly we might expect that that learning curve would be greater for undergraduate cohorts that had considerable less life and workplace experience than the cohort that we're talking about. It's also worth sort of making a comment here about the challenges in developing competency-based assessment items in an e-learning context. Generally speaking, when we're talking about clinical skills, we like to try and do face-to-face scenarios to actually assess those skills. But in this e-learning platform, we had to find other ways to do it. So as I mentioned, we included a number of case-based questions. We also included things like, for example, in the environment module, students were given advice and direction as to where to place themselves and the patient in relation to an exit when undertaking sort of work with a patient. And in their assessment, they had a little person represented on the screen and a fictional workplace presented on the screen, and they had to move that person to the ideal location to mitigate risk. So we did those sorts of things to help to access that competency-based experience and learning. So in terms of future directions for this program, as I indicated, we completed the beta version last year based on the evaluation data, feedback, user interface testing. We launched version 2.0 this year. In the beta version, we had a great deal of success in that we had very, very few sort of technical challenges, which was fantastic. We then had a challenge where the Articulate Storyline developer, which is a software developer, and the platform provider updated some of their software. And so we have faced a couple of challenges in terms of getting those two things to interface in the way that we might want. And so from an e-learning context, I'd like to reflect on some of the challenges with providing learning in an e-learning context, and if people are doing this for grants, to budget into the future for potential bug issues that might occur, because you might think that you've addressed them all, but all it requires is an update in somebody's platform before we have to go back to the drawing board. So in terms of future directions for this program, we will obviously be addressing those issues in the next sort of week and fixing that. So version 2.0 will be well and truly good to go after that. In December 2008, we will be launching an interdisciplinary version of Risk Aware. So we are meeting with key stakeholders across dietetics, occupational therapy, speech therapy, nursing, medicine, exercise physiology, and social work. And we're developing, based on those meetings, an interdisciplinary version. This was not a product or a deliverable from the OLT grant that was required, but we've seen the need for it, and so we'll be developing at least an early version of a platform like that with a hope to look for additional funding. There's a question about if there's any plan to involve pharmacy, and we don't actually have pharmacy that I'm aware of at Deakin, but it would certainly be a very good point, and there's probably a number of learnings that would directly input into pharmacy. So I'm going to now add that to my list. Thank you very much, Christy. And if you have any interest in meeting with us to provide some feedback about particular risks to pharmacists, then please let us know. Matthew's plugging the pharmacy unit at Monash, so thank you. And I do actually, having worked at Monash, have some contacts there, so I'll definitely be happy to. And Christy's saying that she would. That's great. Hello. That's fantastic. So yeah, we're hoping to include and be as inclusive as many disciplines as possible. At the moment, we're going to be focusing this interdisciplinary version on healthcare, but as I've already indicated, you know, there's different disciplines like education, law, IT that are indicating that there is a need for similar products and similar programs. And so what I'd like to finish with before we kind of move through some of the acknowledgements and a discussion is a reflection that, you know, for each of your unique teaching areas, you know, do you feel like there is potentially a need for something like Risk Aware? If there is a need, what are the avenues that you might be able to access to support a program like this? Whilst myself and the team are certainly happy to engage in discussion and those sorts of things around it, we also recognise that there are a number of other learning strategies that are used by other disciplines. So more than anything, we would like to raise this discussion and the importance of managing risk for students. So in terms of Risk Aware, it's freely accessible, and if you would like to actually enrol your students, please contact our project manager, Belle Graham. Her email address is there. The demonstration version is available through the link here, and I'll be talking about our partners. So at the moment, those dark pink areas across this map are the ones where we actually have partners or people accessing Risk Aware. I have yet to crack Tasmania as a Northern Territory, and my goal is to make this a completely national program. So if anyone has friends in that particular areas, please send a copy or a link to this webinar and you know, encourage them to engage. I would like this entire map to be dark pink. All right, so thinking about our partner institutions again, UTAS, yes, we are certainly wanting to target UTAS. Okay, so we have the University of New England, and particular thanks to Associate Professor Deborah Dunstan. We have the University of Southern Queensland, and a thanks to Sue Littler, Dr. Sue Littler. University of Adelaide, so a thank you to the fabulous Associate Professor Rachel Roberts and Dr. Michael Prove. University of, Flinders University, Professor Reg Nixon, University of Western Australia, Associate Professor Carmela Pestel, Australian Catholic University, we've got Dr. Katie Bunch and Louise Alexander, and through the Cabrini Institute we have Professor Leanne Boyd, who's one of the executives there, and Matthew Johnson, who was leading the Cabrini Institute at the time. So just at the end of these slides, you'll see our module lead authors, so thanks to all of those people and other people that are engaged in the website and the module development. And also thanks to our reference group. We had a fabulous reference group that covered just such a broad area of expertise, and we were incredibly lucky to access these very well-resourced professionals and our module credits, so thank you very much. So what I'd like to do is to open it up to questions, and myself and Amanda Dudley, who has joined us and I've seen has been addressing questions. We'd like to answer whatever questions you might have. So one of the ones on the chat is, are you working with nursing facilities with your partners to develop the interdisciplinary version? So at the moment we have staff from Cabrini Hospital or Cabrini Healthcare that are working with us on it. We also have staff from nursing at ACU that are working with it with us, but we are always sort of seeking additional input, particularly from healthcare and placement providers. So if anyone does have any additional links or is interested in sort of engaging with us around this, we would absolutely love to hear from you. We're very passionate about this area. We're really wanting to help students across the country to mitigate risk, and yeah, we would love to work with you. Now, I don't know if there's any other questions. You can talk on your talk. You can also hit your talk button if you'd like to do it verbally.
Hi, I'm just going to answer directly. Sorry. Helen, yes, we'll have the slides up, recording up probably early next week. If you register for the session, I assume you did because you're in here, then you'll get an email.
I think that question was shared by Jane as well. So yes,
if people
Jane,
could please
certainly.
fill our feedback survey in before you leave, that would be great. I shall share this with Jade as well.
Fantastic, and thank you very much everybody for your time, certainly at this time for the Australian audience. This time in the evening, it's really appreciated, and thank you also for engaging in the presentation and with the chat and polls. Your feedback is always really valued.
Yeah,
Thank you.
if anybody wants to use the audio voice chat, you're welcome to press put up your hand or press the talk button to ask a question. Otherwise, text chat's always good. We've still got another 10 minutes if people want to ask questions, etc. I'd just like to make some comments. I think this program is brilliant, Jade. Having worked with lots of disciplines across the university and several universities, this kind of idea of risk and stuff in placements in engineering, in mining, in construction, in hospitality programs, in the vet science, agriculture sector. Farms are dangerous places. You're sending students into workplace. Many workplaces are dangerous places. Physical, mental. So I think this kind of awareness, an online program would be so accessible to students as well, is really a valuable thing. So thank you for doing it.
Thank you very much. No, thank you. And look, I think that one of the benefits of doing this on an e-learning platform is that students can re-access the learning at times when it's salient to them. And that's kind of an important point really, because when they undertake placement, in those early phases, you want to help to prepare them before they undertake it. But then they're going to go out and have these experiences, and so it's really important that they have access to a type of learning that allows them to revisit the points and to just highlight that again to themselves.
Mm. Okay, so it looks like we're not going to get any more questions at this point, other than thanks. So what we'll do is we'll close off the recording, so that's fine. just say thank you very much, Jade, once again, and looking forward to seeing new and wonderful versions of the system. So thank you very much.
Fantastic. Thank you very much. Bye, everybody.